Hare Krishna to all the devotees. A very warm welcome to all the participants who had joined to yet another exciting topic on health, which is live on Hare Krishna YouTube channel. I'm Yograj, representing Bhaktivedanta Hospital and Research Institute, which is a 300 bedded multi speciality tertiary care NABH accredited hospital, which is located in Mumbai, Mira Road. We offer holistic healthcare services for body, mind, and soul with the advantages of allopathic, Ayurvedic, homeopathy, and alternative medical therapies under one roof. We integrate modern medical knowledge with holistic approach to promote overall well-being. Our experts emphasize the importance as a cornerstone of preventive healthcare. This initiative is a part of our flagship program, ISKCON Devotees Healthcare Services, which was launched in Mayapur in 2023. Through this service, we have supported and helped for the health and well being for over 4,000 plus devotees across the globe. Today's special live health talk is on bones and joints navigating orthopedic health. We are honored to have Dr. Girish Rathod, sir, His
Hare
Grace
Krishna.
Giriraj Das, our esteemed consultant and head of the Orthopaedic Department with over 33 plus years of experience and with a devoted service. The session will delve for all of us into the profound science of bone and joint care and share his expertise. So let's begin the session. Hare Krishna Prabhu.
Hare Krishna.
So we'll start about the introduction to the joint and bone health. So, can you give us an overview of most common issues people face when it comes to joints and bones?
In our outpatient department, daily we see patients coming with cervical pain,
Mm-hmm.
backache, knee pain, multiple joint pains,
Correct.
and of course, weak bone related
Mm-hmm.
further progress of disease in the form of stress fractures,
Right.
age old related problems like
Mm-hmm.
arthritis.
Correct.
So, these are the commonest things which we see our in day-to-day practice.
Right. So, what are the factors which contributes to joint and bone issues? So, any primary risk factors that contribute to problems such as arthritis or osteoarthritis?
The contributing factors, especially in these modern times,
Mm-hmm.
in simple, if one word, if I have to say,
Yeah.
it's lifestyle.
Correct. True.
We are so much caught up in our day-to-day hurry of
Mm-hmm.
things.
Mm-hmm.
The typical day starts with the morning. You get up, you are already late. You carry your whatever food available,
Right.
catch rickshaw or train or car,
Mm-hmm.
go to your workplace.
Right.
Whole day you are in air conditioned office.
Correct.
By the time you come in the evening, it's late.
Mm-hmm.
And same cycle again. You reach home so late, you are tired, exhausted, and then you go to sleep.
Correct.
One poet has very nicely said, जब मैं छोटा था तब सुबह को दोपहर को मिलते हुए,
Mm-hmm.
दोपहर को शाम से, और शाम से रात को मिलते हुए मैं रोज देखा करता था.
Mm-hmm.
लेकिन आजकल सिर्फ सुबह को ही सीधी रात को मिलते हुए देखता हूँ. दोपहर और शाम कहाँ चला गई पता ही नहीं.
Yes.
So that is the essence of our modern lifestyle,
Mm-hmm.
where we are living very fast life, and we are living life which is giving us no time
Correct.
for our own health.
Right. And what about the individual lifestyles, like the diet aspect, the exercise, the weight? Is that impact the health of our joints and bones?
Yes, very much. Speaking about diet, let's begin with the basic. even it comes before diet, is breath.
Correct.
We need see the pollution is so much increasing. How much air, healthy air we are breathing in our daily life. Come to the water.
Right.
When I was small, we all when we were small, we used to drink water on railway station, anywhere.
Yes.
Can we think now that? We drink, most of the time we drink water which is purified,
Yes.
food consisting of multiple chemicals, and milk. Nowadays, to get a pure, good, healthy milk,
Correct.
it's so difficult.
Difficult.
So these are the factors which are, as I mentioned, beyond our control.
Control.
So yes, from the osteoporosis and from the bone point of view, we must have a healthy, good, preferably, largely homemade food,
Correct. Right.
which is very, very essential.
Right. Right. Correct. So let's talk about some early warning signs. So, what are some early warning signs of joint or bone problems that individuals should be aware of?
Generally, these early morning signs start coming up at the early stage of middle age.
Okay.
Unusual aches,
Mm-hmm.
backaches, tiredness, lethargy, and
Mm-hmm.
most important, things which you could do easily starts becoming little difficult.
Correct.
These are the early signs.
Mm-hmm.
Irritability. Because what happens that the seeds of these signs are sown in childhood
Correct.
and they don't show the signs till our reserves start depleting,
Right.
and they start depleting in early. You have already started your life 29, 30.
Mm-hmm.
By 35, 40, those reserves starts depleting
Correct.
fast. We
Correct.
have not gained the reserve which can last for lifelong.
Correct. Right.
And that is a time, 35, 40 is a time
Mm-hmm.
where most of our patients, males, females, they start coming with the signs of orthopedic problems.
Okay. Right. So, speaking about the preventive measures now, what are the preventive measures can individuals take in maintaining the healthy joints and bones, especially as you mentioned about the middle age? So, are there any preventive measures?
This word preventive measures, we used to have a subject in our medical college, PSM,
Mm-hmm.
Preventive and Social Medicine.
Right.
With a lot of guilt, I must say that we used to take that subject as lightly as possible. But today, after 37 years practice, I must tell you, okay, prevention is the best cure.
Just cure.
Prevention should begin right from the time when a child in his mother's womb.
Correct.
That is the time when mother should have enough natural nourishment so that child's health, especially bony health.
Mm-hmm.
I'm not speaking about the other medical, psychological, other aspects, spiritual aspects, but especially from the bone health, I can say that mother must have a good amount of a nutritious diet which will give a child a healthy bone.
Correct. True.
From the birth time, again, a natural mother's milk in initial months or few more than a year or so. That breast milk of a mother is an investment of mother in a child's lifelong
Okay.
health.
Right. True.
Then, as the child grows, please give exposure as much as possible to the open air and the games.
Mm-hmm.
Nowadays, when I ask my children when they come to my OPD, what is your favorite game? And they tell me game of so and so, which is not game which is played in the grounds, but the game which is played on the computer.
Computers.
So this is the serious issue. Again, if I come to the one poet Gulzar ji has said, मेरे घर के सामने का मैदान आजकल खाली रहता
खाली
है.
रहता है.
लगता है मोबाइल बच्चों की गेंद चुरा गया है. It's our duty
Mhm.
as a prevention to give our children that gain back to them.
Back to them. True.
So the prevention is in the childhood.
Correct.
In young age group, regular exercise, walking,
Mhm.
simple exercise. We do not have time for a gym. We do not have time for the other exercise. At least when you're going to your office, workplace, coming from workplace, at least once, use that 20 minutes of your walk up to your home.
Correct.
At least minimum 20 minutes. Do not use a vehicle.
Mhm.
Use that for walking.
Correct.
You know, that is the simplest thing. you know. So walking is most important. Diet, as I told you, have a
Yes.
healthy homemade diet. Milk and milk products,
Mhm.
very important.
Correct.
And it is the natural products which are going to get stored in your bones for a lifelong.
Correct. True.
And which you don't do that, which you do not conserve those things in your bones, then in the old age or early middle age, we have to depend on a medicines
True.
or a tonics or a nutrients.
Correct.
It's very much essential that how we spend our youth and childhood in conserving
Mm.
the calcium, storing our calcium in our body, that will play the role how your bones will behave in your later age.
Later age. Correct. So let's come to the common joint injuries.
Yeah,
So could you just discuss some common joint injuries and how they are typically treated?
I was attending one conference, and there was a discussion that nowadays we are seeing in the children, especially
Mhm.
sports injury more. It is important what type of surface our children are trained to play.
Correct.
Artificial surface creates, sometimes if they are not trained properly, the speed and the friction between the artificial surface can cause more injury.
More injuries. Correct.
Also, the speed with which the types of games which we are playing, what we used to play in our childhood,
Mhm.
and the games which are being played now, some games especially, which are more violent to the
Correct.
body,
True.
more induced with the passion. So nowadays, the children are coming more and more with a serious bony injuries.
Correct.
And it is very, very important that parents should be aware that it is your child's mindset, physique,
Mhm.
development, and constitution.
Correct.
As per that, the compliant games should be allowed the
Correct.
child to play.
True. Uh, what type of exercises or physical activities are most beneficial for maintaining our joint and bone health?
Most important element of bone health is a balance. Yoga means balance.
Correct.
When balance is lacking, bone seems to be the along with other bodies parts. You see, the simple thing I'm telling you,
Mhm.
right from your home, you come out, you're going down staircase and you are mobile. We see so many patients. Mobile related accidents
Correct.
is a big thing.
True.
Driving, climbing down, driving, crossing roads.
Mhm.
We are not careful.
Correct.
Mobile has taken away our attention from our own safety.
Mm-hmm.
So that is one very much important. You asked precaution, am I right?
Precautions.
Prevention, you
Yes.
asked.
Yes.
So most important then whenever you are walking out, huh, be careful that we are not alone.
Mm-hmm.
There are high speed vehicles moving around us.
Correct.
That's most important. If you see, if you calculate all the World War related deaths and you calculate the deaths related to the modern time accidents,
Mm-hmm.
they are far, far more
Correct.
than the last three world wars.
True. Absolutely.
So, first important thing is that be careful and cautious about yourself when you
Mm.
are moving around.
Correct.
Second thing, breathing. Microcirculation is coming up in a very big way in modern science,
Mm-hmm.
which was there in our culture in ancient Vedic lifestyle. When you breathe deeply,
Mm-hmm.
the oxygenation of your blood, the oxygen which reaches to your organs, they help us to reduce the degeneration and delay the aging.
Correct.
One of the factors why the bones have started aging so fast
Mm-hmm.
is we do not breathe
Correct.
sufficiently.
True.
Inhalation, exhalation, inhaling oxygen, retaining, allowing that oxygen to go to our tissues,
Mm-hmm.
and allowing slowly carbon dioxide to come out. That's just a very, very important factor for microcirculation.
Correct. Right.
Third thing, walking. Simply by walking at brisk speed, making it as a way of life is sufficient to keep at least your bone health, right from your spine to your every single joints.
Correct.
If possible, go for a simple yoga. 10 minutes, 15 minutes. It's difficult to go for a gym.
Mm.
That is yoga you can do.
Correct.
Drink sufficient water.
Mm.
Important.
Absolutely.
We have stopped eating normal water.
Correct.
Sufficient. Food, as I said, try and avoid preserved food.
Junk foods.
Try and avoid junk foods.
True.
Try and avoid drinks which are coming in the bottles.
Mm-hmm.
And last, but the most important, is have a good sleep.
Correct.
We have forgotten huh, to see. And our when I was small in our villages, 7 o'clock means everything used to be over.
Yes.
But
Yes.
because sleep is not there, it's very important as per the medical science that
Correct.
it affects 44 types of systems in our body.
Wow.
If you do not have sufficient sleep, 44 types of disease can take place, and bones and joints
Yeah.
and rheumatisms are very, very important.
Right.
Your intestinal health,
Mm.
extremely important.
The gut health.
Gut health. Nowadays, in orthopedic world, this is coming up. This subject is coming up in a big way. Intestinal health and bone joints. But
Mm.
it was there in our Ayurveda thousands of years back.
Correct.
It's important what you eat.
Correct. True. So, sir, we have one question. I have DNS of nose, which means bent nasal tender, due to which my right side nasal breathing is tough. So, will it affect my bone health?
If it affects your breathing, then get it solved by
Mm-hmm.
an expert.
Okay.
If an expert says no, then nothing to worry about.
Nothing to worry
If
about.
you are able to manage your good inhalation, exhalation, nothing to worry.
Correct. Right. So, I'm requesting our participants who are with us to check on the screen. We have displayed our ISKCON Devotee Healthcare Services banner. Please make a note of the important contact numbers. Also, check on the bottom of your screen. You can check the important contact numbers which are being mentioned, on which you can call and have similar sessions for your congregation. Again, I'm repeating, to check on your screen, the banner which has been displayed, which is of ISKCON Devotee Healthcare Services. You can make a note of the contact numbers which are being shown. Also, I'm requesting participants to please drop down your queries in the chat box. We will answer each one of them. So we have next question. Can stress or anxiety contribute to neck pain? If yes, how can we manage it?
स्ट्रेस एंड एंजाइटी कहाँ नहीं है? It is in the air.
Correct.
I have heard in my childhood कि बम्बई में हवा में हाथ डालो तो पैसा होता है, बट उसके साथ में मुट्ठी में स्ट्रेस और एंजाइटी भी आ जाती है. So it's true. Stress and anxiety leads to muscle spasm.
Correct.
Unnoticed muscle spasm. This muscle spasm in your cervical spine, in your lower back, leads to the spasm and occlusion, partially, temporarily, of a microcirculation. When they do not receive sufficient blood supply, muscles go into what situation called as muscle cry, lack of muscles, blood supply, and that leads to fatigue.
Okay.
That is why you feel very nice after you go and have a small massage. The reason is that muscles, when they are massaged nicely, they they are relieved from that pain because of the improved microcirculation.
Correct.
So it is very much essential that when we are especially sitting in air conditioned offices without much of a sunlight, that a regular stretching at an interval of an hour or so, it can be even for 5 minutes.
Correct.
That can go a long way. We have heard in our history that Napoleon Bonaparte used to take 3 minutes nap. Then he could fight the whole battle for a long.
Yes.
So we all are small Napoleons in our own way in our life. Correct. Battling every day.
True.
So a 3 or 4 minutes of small those stretching exercises can help us to go through our day-to-day struggle in a long way.
Correct. So, when it comes to surgery, which would be necessary, so how do you determine whether surgery is necessary, and what are the most common procedures which are performed in orthopedic?
Whenever patient comes to us in our OPD, they come already when somebody has told them that surgery is required. They come with an X-rays. These are the basic investigations.
Correct.
Advanced investigations like MRI or CT scan. I generally follow one particular dictum is that how much functional capacity is affected of an individual.
Correct.
If functional capacity is 60-65% more, we can try and manage, bring them up to 70-80% with medicines, change in the lifestyle, weight reduction. However, if it's more than 40%, then it's better if surgery is needed, it should be done. Because when the functional capacity is 80%, and then you expect 100% recovery, that time surgeon's hand are tied.
Correct.
We cannot give you 100% relief. Right. So that is why most of the time the surgeries are named or they are defamed because we go to the surgeon very late. True. And then the results are not as per the patient's need.
Correct.
So commonest surgeries, of course, now modern lifestyle has increased joint replacement, spine surgeries, neck surgeries, infections,
Mhm.
tuberculosis is a common in India, stress fractures, weak bones without fracture give away simply because of the body's weight. You will be surprised. We see this nowadays. Initially, we used to see this in old people. Now it is in even
Absolutely.
young people. Stress fracture is a common because they don't. Mother come always in our OPD. Young teenage girl or the boy is there. Every time there is a complaint, sir, she or he doesn't eat vegetables. He or
Correct.
she doesn't drink milk.
Mhm.
Sir, he or she just doesn't always wants to eat food from the outside.
Outside.
So I tell, especially girls, I tell them, बेटा जब शादी होके जाओगी तब ये खाना याद आएगा.
True.
And even boys also, I tell them, when you go
Yes.
for studies outside,
Uh-huh.
जब हॉस्टल में खुद को बनाना
Banana
पड़ेगा,
padega.
तब मम्मी की ये याद आएगी.
Absolutely. Absolutely.
So yes, these are very very important
Correct. Right.
factors.
Right. So we'll take the next question. What needs to be done for ligament tear? It's 4 year old. Don't have trouble now, but occasionally once in 2 months, approx when there is a pressure on knees, gives some pain. Feeling can't play badminton.
See, that's why the important thing is this, if you have trained your knee from childhood
Mhm.
to run, to play, if your ligaments have grown through those exercises,
Correct.
then they will be able to hold up that additional strain.
Right.
It's very important.
Mhm.
If somebody wants to go to climb Everest without preparing itself,
Mhm.
that will be a disaster.
Right.
Similarly, we see nowadays suddenly one fine day somebody decides to go to badminton or start a particular power gym
Mhm.
exercises.
Mhm.
But if they are not trained, they have not gradually strengthened their ligaments over the years.
Right.
Sudden sport activity is not going to help them. Rather, it is going to harm them.
Harm them. Correct.
You
True.
may say badminton, what is there? But if your shoulder is not trained
Mhm.
in doing simple exercise like pull-ups or push-ups,
Mhm.
then simple smash shot can cause subluxation of
So
the shoulder.
correct.
Yeah, we are saying this regular practice. So that's why it's important that first, if you start playing games is wonderful, but start training yourself for a few weeks, few months,
Mhm.
and then gradually enter into those sports. That way, you will be able to enjoy and play that
Correct.
sport which you like for
Correct.
a lifelong.
True. Correct. We'll take the next question. I have a rotator cuff tear for more than a year. Is it too late to go for a surgery?
No, if your age is uh, young, and especially rotator cuff tears, we it depends on the age. But if young age, it's better get an MRI done. Go to a specialist, shoulder specialist, who will be able to manage your surgery. And 1 year is not too old. If you wait, it can become a difficult problem to manage later.
Correct. Right. The other question we have, main issue is the knee pain. So, is there any particular food or diet to reduce the pain?
There was a study in Japan which took two sample studies. One sample study, people were sitting on a normal chair and table with your knee 90-degree flexed, and other group of study
Mhm.
were made to sit on a tall table with a tall chair where we have to climb one step and your legs are hanging down.
Okay.
After 3 or 4 months, they found that those group study people who were sitting on a higher chair with the legs hanging down, they had a less knee pain. The reason? When you are sitting on a chair for 8, 10, nowadays 12, 13 hours
Mhm.
with your knee bent 90 minimum or more, your kneecap is jammed against your below bone, femur. That jammed situation causes occlusion of microcirculation, and that causes pain. Even the driving, the same thing. When you drive, your chair is like this, even not even like this. You
Right.
sit like this. Always have slightly behind your chair, slightly raise your height. Give enough space for your left foot to go in a boot space so that at least your left knee is mobile.
Correct.
But otherwise, in the stress of a traffic and everything, your knee is jammed for 2 to 3 hours in a day.
Absolutely.
So these are the causes of a knee pain. And apart from that, of course, diet,
Mm-hmm.
exercises, morning exercise.
Mm.
Diet, most important diet, as I told you, be simplistic on your diet.
Right.
That will you will be on lot of rewards on your knee and on your bone.
Correct. Right. True.
It's important.
Yes, absolutely. We'll take one question. So, from 1 month, I'm feeling pain in my legs. Sometime it shift to lower part of the legs, big toe. Sometime heel, but now it got shifted to my lower back. Also, I feel tired.
So this, if I have to answer for everybody's advantage, this type of a pain are arising from the lower back. Commonest cause is a bad posture,
Mm-hmm.
sitting crouch position. One very important factor for this type of pain is forgetting your own spine and getting completely dissolved into the world which is there in front, called as television screen or a computer or
Yes,
your mobile,
mobile phone.
huh? Where you forget your spine is crying. So it is very important that during your work, during your resting hours, how you keep your spine in a proper position.
Correct.
Important thing is that changing position of a spine. You know, keep your spine position changing. That is going to be very important.
Mm-hmm.
And when this back, which is initially aching at one particular point, and when the pain starts coming down to your thighs, buttocks, and calf and toes, that means there is a spinal cord is irritated from the side, which has got called a nerve root. A disc is irritating your nerve root, and this is a time it is important that you must consult a spine surgeon, get X-rays, get MRI done, and do the needful in the terms of medicines, changing posture,
Mm-hmm.
and at the most physiotherapy.
Correct.
It can solve this problem at this particular stage.
Right. Is that a sciatica nerve you're talking about?
Yes, sometimes it's a sciatica now.
Correct.
Back is coming up in a big way problem, back problem, because
Mhm.
of the bad posture.
Posture. Correct. True.
Suddenly going in activities like a gym, from day one you want to become a
Bodybuilder.
bodybuilder and you start lifting something heavy. The body needs to be get trained. So do
Mm-hmm.
not do. In Marathi there is a one kahwat, ati tithe mati.
Mati.
Means when you do excess, only thing we get is a sand. We don't get the desired result. So
Correct.
we have to do activities like gym and all those things gradually,
Correct. True.
slowly. And be cautious. Suddenly don't do activities which you are not trained to do. Saman shift hua hai, ghar change hua hai, suddenly you start shifting things and spine gives away.
Correct.
So you should be cautious in
Mhm.
present times.
True. So let's talk now on osteoporosis, which is a serious concern of bone health. So particularly in older adults, especially females, when they come across the menopause stage. So how can people prevent or manage osteoporosis?
At Bhaktivedanta Hospital, we have been conducting the last 25 years camp at Pandharpur.
Mm-hmm.
And recently I went to Kumbh Mela,
Correct.
Mahasnan. And my general observation as an orthopedic surgeon at these particular places at Pandharpur, average age of a Varkari is 50, 55 plus, average I'm saying. And in my interaction with them, I see that they have been walking at least 30 kilometers or more one way.
Okay.
And I always wonder, what is the secret? They are far, far elderly. They have been doing this for years together.
Mm.
The secret is in their lifestyle. They have been on the fields, they are exposed to sunlight,
Right.
they have got regular lifestyle, and they sleep regularly,
Regularly.
and they do not have problem of osteoarthritis
Correct.
and osteoporosis.
True.
It's not that they have a huge 12 course meals every day, simple food,
Correct.
but those simple food uh, are healthy for their bone.
Mm-hmm.
That simple lifestyle is healthy for the bone.
Correct.
So the osteoporosis, one of the commonest reason is that our lifestyle,
Mm-hmm.
lack of sunlight, and important thing is that what type of food we are ingesting.
Correct.
There are drinks which we have a regular way of life drinking in our life
Mm-hmm.
that takes away lot of calcium from our bones,
Correct.
and certain parts of the world where this type of drinks are consumed regularly as the way of life,
Mm-hmm.
and it has been proven that they do have more osteoporosis
Correct.
and more osteoarthritis.
Mm-hmm.
So it's very, very important that we have to. And nowadays, one very important thing is that young people are becoming more and more health conscious, which is very good.
Correct.
Which of late, after the COVID and around that time, we are seeing that young generation is becoming more and more health conscious.
Correct.
So that's a very, very good thing.
Thank
But we have to certain habits like smoking and those other bad habits, we have to be careful about that, but it if taken in excess, it can affect our health to the
Absolutely.
irreversible way.
Absolutely. Absolutely. So we'll take another question. I feel pain on heel when I lie down on bed. I have to put pillow below heel, and I'm 67 years old.
Heel pains are commonly because of the spur, and that is because of our when we walk, when our heel is stretched by an elastic band causes spur formation. Again, this spur formation is because in city we live a life where we wear shoes, we walk on smooth surfaces.
Hmm.
Generally, those who walk in the fields, they do not get spur formation. But
Yes.
because we have this habit of walking on a smooth surface, so little injury causes irritation and causes the new bone formation.
Mm-hmm.
So always better to get an X-ray done, take anti. But simplest thing is that putting your feet in a warm water with little salt,
Mm-hmm.
and night before you go to sleep and morning before you start your day, and wearing soft chappals
Correct.
should be
Yes.
all right. Further things I won't be able to say as
Mm-hmm.
per the actual prognosis, actual diagnosis. We can say what can be done for you.
Correct. True. So let's now talk about the minimally invasive surgery. So can you explain, sir, the benefits of minimally invasive orthopedic surgeries and how they compare to traditional surgical options?
It is also called as MIS. It is coming up in a very big way, very helpful way. Minimal invasive surgery means that in that procedure, generally we used to do a normal open surgery,
Mm-hmm.
which is also now being performed. Expose as much as area is needed for your surgery, do the corrective measures, and then close.
Correct.
This type of surgery had an advantage and has an advantage that you have sufficient exposure in front of you.
Mm-hmm.
You are able to do your job nicely in a reasonable amount of time.
Correct.
However, the disadvantage was and is that recovery times takes little longer.
No.
Minimum invasive surgery means we do small opening, and with the help of additional instruments like in a joint arthroscope,
Mhm.
or in a spine, there is endoscope, where with the help of a scope, we can see the pathology, remove it, and close it. The wound is small, recovery is faster,
Mhm.
but then it also has its own advantages. Sometimes things can be left behind, disease process can be left behind.
Correct.
So yes, it also has advantage, but now with the more expertise, the minimal invasive surgery, even in terms of the fractures and plates and screws, we do go for a small incision and
Mhm.
finish those surgeries in a reasonable time and with a reasonable faster recovery.
Correct. Correct. So we'll take one question. I'm suffering from cervicogenic vertigo from last 4 years. In X-ray, it shows osteophytes. What should I do?
Osteophytes means this problem is there for long. The meaning of osteophyte means one bone and the second bone. There is a constant friction over the years,
Mhm.
and these years of friction uh, is caused by a bad posture, bad habit,
Mhm.
and this friction leads to the degeneration of a disc in between, and that constant friction causes a new bone formation at the edge,
Correct.
which is called as an osteophyte, and that causes pressure on a spinal cord. So whenever there is a osteophyte is seen on the x-ray, first thing is that consult a spine orthopedic surgeon,
Mhm.
get your MRI done, see how much pressure is there on the nerves. And it's not necessary that when you go to spine surgeon means he's going to ask for surgery. No, it helps us, MRI helps us to determine that where do we stand today and how we can prevent further progress of the disease.
Correct. Right.
So it's important that get the MRI done and then take a physiotherapist or a specialist spine surgeon's opinion, and then as per that his advice, go for the further
For the treatment.
treatment.
Okay.
But it should not be taken lightly.
Correct. Right. So again, I'm requesting participants to check on the screen. We have displayed our ISKCON Devotee Healthcare Services banner. Please make a note of important numbers. Also, check on the bottom of your screen. You can make a note of the contact numbers which have been mentioned, on which you can call and have such kind of sessions for your congregation as well. Now, let's talk about the role of technology in orthopedics. How has technology such as robotic surgery and 3D imaging impacted orthopedic treatments and surgeries?
Yes, somehow I have been coming from that generation where we used to treat patients with plasters, then simple plates and the nail,
Mm-hmm.
and then the uh, titanium plates and the nails,
Right.
then the joint replacement, mm, and then now the robotics. The
Mm.
whole spectrum we have gone through, and its technology has really improved patients' care remarkably.
Correct.
The quality of implants, which now, because of the technology, the titanium plates, which
Mm-hmm.
are very light, very sturdy,
Mm.
and at the same time, they are contoured with the patient's bones. So they are very, very helpful in especially trauma fracture
Right.
patients.
Right.
Arthroscopy, newer and newer inventions in the arthroscopy is also helping in sports and medicines and injuries.
Mm-hmm.
And of course, speaking about the robot, it's a very wonderful tool which helps in surgeon in deciding the plane, the direction, the measurements of the cuts. Yes, it is right now, without any doubt, it's in evolution stage.
Correct.
Much more things are going to evolve in the robotics,
Mm-hmm.
and it is in the evolving stage.
Correct.
Definitely coming years is going to bring more fascinating changes for the advantage of the patients
Correct.
in
Correct.
robotics.
Right. Right. We have received one question regarding the osteoporosis. So, can osteoporosis be reversed? I have pain on the upper side of the foot and sometimes tingling on the toes. What could be the cause and remedy, if any?
So these are two separate things. Osteopenia and osteoporosis can be reversed.
Okay.
One thing is that it's never an irreversible thing.
Mhm.
But after particular age, you need to have a constantly be on medication, right from the diet, medications, and sometimes you have to take certain types of injections as
Correct.
well,
Correct.
depending on the severity of the bone density.
Mhm.
Of course, there is one investigation called as bone densitometry,
Hmm.
which helps us in diagnosing that what is the level of your osteoporosis, and depending on the doctor can decide
Right.
your what type of medicines you need.
Mhm.
But diet and exercise
Hmm.
is at every part, every stage of your life is uncompromised part of the
Correct.
recovery.
Right.
Regarding your pain in your heel and pain in your tingling in your feet, there can be a different, it's a very wide thing to say. But yes, always tingling in the feet means we have to see from the spine from the point of view,
Mhm.
we have to see from the diabetes point of view, we
Right.
have to see from the blood vessel point of view. All those things, so better always to go to your family physician, see, take their guidance. They will be able to help you to go either to an orthopedic surgeon or a neurologist or a physician,
Correct.
and then accordingly please take further
Absolutely.
investigation and treatment.
Absolutely. We just now spoke regarding the sports related injury. Now, specifically, if any athlete often face the joint injuries. So, what are the most common sports related joint injuries and how are they treated?
Most common sports related injuries is one is a football,
Okay.
where ligament injuries are very very common.
Common.
Again, it requires a child or somebody who's trying to play football, they need to be trained.
Mhm.
Their ligaments have to be strong enough, then they can go for the tackling and different
Right.
aspects of, because
Right.
that requires, simply it is not the speed,
Correct.
it is the health of your ligaments which hold the bone in different maneuverings.
Mhm.
So that is where they give away, and then most of the time the impact from the opposite side,
Mhm.
unknowingly,
Right.
that causes the injury. The commonest injury is in the ligament injury during the in the football.
Mhm.
And yes, nowadays there are so many other sports are there, like skating, where if you are not given sufficient padding to elbow,
Correct.
helmet,
Yes.
things can go wrong. But yes, football is a very well, children love this game. And just to make them aware, I love football. And they said, why, sir? You are 63. I love because it gives me lot many patience. The message goes that you have to train yourself. You have to
Yes.
first
True.
be careful,
Yeah.
you know. But football causes a lot of knee ligament, ACL injuries, collateral ligament injuries.
Correct.
That
Correct.
is the common. Another commonest injury, sadly, is a two-wheeler injury.
Correct. Absolutely.
Again, I am telling you, anything beyond 40 and two-wheeler, you are not the controller.
Correct.
God is the controller.
Absolutely.
So be careful while driving two-wheeler. In a day, we see at least 4 patients two-wheeler accidents.
Yes. Correct.
There are some, even if you are safe driver, there are so many factors: construction work, seepage of the oil, liquid. Suddenly, dog comes. You are not under your control.
Control.
Be careful while driving. And while four-wheeler, always be careful. That beyond 80, be cautious. Still 80, you can do something for yourself.
Absolutely.
Beyond 80, it is difficult.
Correct. Right. We'll take the next question, sir. I want to ask you household works causes pain and about some information about the rheumatoid arthritis.
Household works, we did research uh, about the last um, 2 decades. There are multiple causes of injury. I speak about injury first.
Correct.
In the
Yes.
household, 44 types of injuries can take place
Oh.
right from you enter your house, your hall, your kitchen, bedroom, bathroom. Bedroom, children play on the bed, just raise the hand and that
Yes.
fan
Fan.
is there.
Ceiling fan.
Diwali times, housewives come, go on the stool, try to clean the fan,
Webs.
and you forgot from where you got up. You got up down from the other side. There is no step. You lying
Correct.
down. Door, you are talking to your neighbor nicely. Rainy season, your finger can get. You have put nice lakhs of rupees worth of granites,
Mhm.
and phone call came. Somebody came, and the maid has just put water for clothes for drying. You run and you sleep, and you have a
Correct.
back injury. So that way, in the house, and you are in the kitchen, you are on your phone and grating the carrot,
Correct.
and the carrots are nowadays so costly. Till last bit you go and you scrape off your tendon, extensor tendon. So household injuries, you have to be very, very careful.
Even a small soap in the washroom
Yeah,
can cause major
very
injuries.
much,
True.
very much, very true.
Absolutely.
So many times that last bit of soap, always put it under the in the drainage.
Drainage.
Don't let it be there in the that, because the new soap, it sticks, and when you use that falls off, and then you fall
Correct.
off.
Right.
Regarding household pains, yes, the ladies especially, they are constantly standing, working, whole day goes in a household chore, taking care of all the family members. And because of constant standing, the congestion of the blood vessels, the fresh blood goes, and the used blood is not able to go against gravity. That causes congestion,
Correct.
microcirculation, vasculitis, insufficiency.
Mhm.
And that is a cause of the thigh pain, calf muscle pain, swelling, backache. These
Correct.
are the commonest. And of course, nutrition in our systems are like that. House lady, you know,
Mhm.
always takes care of everyone, you know, all the family members except self.
Correct.
And plus working, if you are a working lady, then those 8 or 9 hours plus traveling plus household work plus children's care, where is the time for yourself? So that
Absolutely.
is the time that 40-45 generally patients come in our OPD with physical and emotional that fatigue. So one should give time for yourself, at least 20 minutes in a day. Very, very essential.
Correct. True. So let's talk about the alternative treatments. Are there any non-surgical or alternative treatments for joint and bone conditions that have shown promise?
Yes, definitely. That's a very good question. The alternative treatments in the non-surgical, first I'll speak about, is
Yes.
that in joint arthritis, especially when in our OPD stage 1 and stage 2 patients come where early osteoarthritis is setting in, we know that this will lead after 5 years, 7 years, 10 years down the line. Wherever there is early osteoarthritis, where there is a space between the joint, we give something called as injection platelet rich plasma, where patient's own blood we use extract the platelets which has got a healing and a new growth capacity.
Okay.
So that we inject with 1 day admission,
Mm-hmm.
and that creates a wonderful new regeneration of
Mm-hmm.
a degenerative, especially those joints which has got patchy areas of degeneration, which can become a complete degenerated knee.
Mm-hmm.
So that's the one thing. Platelet rich plasma is a very important thing coming up in a knee. And also, as at our Bhaktivedanta Hospital, we have a integrated department where I am also working with them as an orthopedic surgeon, that how in Ayurveda, homeopathy, allopathy, and diet we can help.
Mm-hmm.
Also, I went and with my daughter, I went into uh, uh, Himalayas and learned preventive orthopedics through yoga. That is a time there was a new chapter came in my
Mm-hmm.
practice, is that how we can preventive orthopedics is the one which I am now giving more attention after 37 years.
Correct.
That it is always better
Hmm.
uh, that by every day practicing yoga, a balanced lifestyle, you can definitely do a lot of preventive work in you. And even if it is too, it's never too late. You can start
Correct.
basic exercises which can help in your bone and joint health.
Correct. Right. So we'll take one question. Only right side knee is paining. Is there any medicine? and they doesn't have any kind of comorbidities like blood pressure or diabetes, but still there is a consistent pain in the right side of knee.
Always, whenever there is pain, you know, we have one particular thing that the pain, why, that is more important. More than the medicine, ask why that pain is there.
Correct.
Once we know why, then we can take care of that particular pain.
Hmm.
So always take an expert's opinion. Why I'm saying expert's opinion is that nowadays our lifestyle has become like that.
Right.
Our grandparents के time कितने orthopedic surgeon होते थे. But now it is important that X-ray, if possible, physiotherapy is possible, kneecap. Most important, prevention of those activities which are likely to cause the pain.
Correct.
See how things are happening.
Hmm.
If things doesn't resolve, then take expert's opinion.
Correct. Right.
Huh?
True.
Body is a wonderful machine which can cure, heal itself. But if it doesn't, in spite of removing cause, possible cause, then take an expert's opinion.
Correct. Right. So nowadays on the televisions also we see lot of advertisements which comes regarding some deficiency in calcium. Pop up the medicines or take some powder, dilute in the milk, and then you drink it. So are those products effective, or they really need to meet the orthopedic consultant first and then take the supplements?
Uh, what is the interest behind that particular address advertisement, that we have to see.
Correct.
If the interest is a genuine help for the patient,
Mm-hmm.
or it's a monetary
Correct.
gain.
Right.
So, an interface in that to determine will be a doctor.
Correct. True.
So, it's always
Absolutely.
better that take a doctor's
Correct.
help and see what
Right.
is, because all the calcium medicines are not the same for the same patient.
Absolutely.
One particular patient may require, along with the calcium, some additional supplement like
Supplements.
magnesium.
Correct.
Which calcium carbonate, which type of calcium is helpful, that is also essential.
Correct.
So it is important that the doctor determines that this type of calcium is
Hmm.
good for you.
Correct. Right. Uh, Speaking about the emerging trends in the orthopedic care, so what are the emerging trends or advancements in orthopedic care should patients be aware of, especially when it comes to joint replacement?
Yeah. See, joint replacement is a multi-billion-dollar industry. It has been uh, awarded the best surgery of last century,
Correct.
because joint replacement has done wonders for
Hmm.
humanity,
Correct.
without any doubt. And in joint replacements, as we have seen now, the quality of implants in
Hmm.
terms of the newer trends, the quality of implants has improved so much that joint which used to last, we used to give guarantee of 10 or 12 years.
Hmm.
Now those joints will easily last for 25, 30 years
Correct.
down the line.
Yes.
So that's the quality of implants have improved.
Hmm.
The instrumentation, the all the what we call it as a jigs in this knee replacement surgery,
Hmm.
they are so wonderful now. The
Correct.
joint replacement has become much more easier. Not only that, the sterility,
Hmm.
operation theater sterility, that has become now, with the time, we all the modern medicine has come together to help to reduce the infection rate, which is very important. It's not only
True.
instruments, it's the infection rate, the complications, all these things have gone down.
Correct. Right.
And yes, the last is the robotics, which is, as I said, is evolving stage.
Mm-hmm.
So this in terms of the joint replacement, and now with the new things, the artificial intelligence which is coming up,
Mm-hmm.
artificial intelligence and robotics
Hmm.
is going to be the new chapter for the patient's benefit.
Correct. Right. Uh, Next question we take: can we take walks and exercise even if we have knee pain?
Yes, it's always the regular question. Yeah, there is one cycle that because I have a knee pain, sir, I'm not able to walk.
Hmm.
Because I'm not able to walk, I'm gaining weight. And because I'm gaining weight, my knee pain is increasing. So we have to break this cycle.
Correct.
So what we can do is that with the knee pain, use additional supports like a kneecap
Hmm.
or a knee brace.
Correct.
Duration of walk, you can split it, not straightway 1 hour, but maybe 20 minutes, 20 minutes, 20
20
minutes.
minutes.
Another thing important is take a dietitian help. Try and reduce your weight. Avoid sitting cross leg. Avoid sitting squatting.
Correct.
These are the things, small, simple change in a lifestyle, which will increase your walking, which will reduce your weight, which will reduce the load on your knee, and
Correct.
your knee pain will be taken
Correct.
care of.
Correct. True.
Because one factor, always remember, if you are on a higher side of the weight, that is a factor, that is a cause of your pain on the knee.
Hmm.
If the cause is not taken care, no doctor in the world will be able to take care of your pain.
Correct. Right.
The cause has to be taken care first.
Right.
And once the cause is gone, doctor is also gone.
True. Correct. We'll take the last question, sir. While walking, my knee gets stuck. Then I take a pause, shake my knee. Tuck noise comes from my walk again. Is it a big problem? Should I? What should be done on
Yeah.
that?
Regularly patients ask us, sir, ये knee में कट करके आवाज आता है.
Hmm.
So there are two types of noises.
Hmm.
One is regular click, which comes because of the factors which are outside the knee,
Hmm.
where a muscle and a tendon, when they have a friction with the bone, they causes a click, which is harmless.
Correct.
However, just little bit side topic, that we do have a habit of making those clicking noises again and again. The neck is there, shoulder is there, lower back is there, toes are there.
Fingers.
So that is the habit which can lead to the degeneration early.
True.
However, the knee click, which is there, which comes occasionally, and
Hmm.
especially in this type of case where you feel uncomfortable and you make that noise and then you feel comfortable, that is likely that in between the two knee there is a cushion. Mother nature has given us a cushion, what we call is a meniscus. If that is loose or that is partially torn, it may be getting flapped and it must be coming in your movement.
Correct.
And once that flap is unlocked,
Hmm.
you feel uncomfortable, noise, and you feel comfortable.
Correct.
In such situation, always do not try to make it the way that you lock it and unlock it. It's a nice feeling. No, don't do that. It can increase further.
Correct.
Avoid sitting cross leg, avoid squatting. And if it doesn't get solved, then it's better to uh,
Correct.
get it
Right.
resolved by getting the X-ray, MRI, and a physiotherapy.
Correct. Right. So, lastly, what is the takeaway message you want to give to our devotees and also to our participants who are there with us since the start of the session? When should they meet an orthopedic consultant? Secondly, what are the basic test or the imaging radiology things they should undergo?
First is that please make simple brisk walking as a way of life.
Hmm.
That will go long. I'm not speaking about jogging. I'm not speaking about mm, other things. Just make a brisk walking as a way of your life.
Hmm.
Second thing you asked about which investigations
Yes.
should be the
Basic investigations.
basic investigations is nowadays, I'm sorry to say, but the patients come with the nearly 100 tests, and that is on a small print on the mobile. How am I going to see those 100 tests, which most of the things I'm not
Correct.
uh, I correlate. I'm not saying I'm not concerned. I cannot correlate with
Right.
that. So regarding the basic investigations for your blood is that calcium,
Hmm.
phosphorus, uric acid, hemoglobin, RA test. And these are the basic bone related tests.
Correct.
If you have a difficulty, then vitamin B12, D3, but they are costly tests. So I generally do not recommend on every time, generally.
Hmm.
Basic X-ray of the knee, X-ray of the spine, and if need arises, spine or knee MRI.
Okay.
These are the investigations which you know, if there are fractures, and then in that case we have to go for a CT scan, which is also very good investigation
Correct.
tool. And we have by Srila Prabhupada's grace, we have at Bhaktivedanta Hospital now CT, three-dimensional CT, X-rays, and now very soon we'll have
MRI
MRI
also.
as well. So it as far and PET CT also is come
Yes,
up. So we are equipped with all the investigations and
of
other
course.
modalities of treatment.
Correct.
We have almost 11 orthopedic surgeons,
Right.
each specialty like arthroscopy, pediatric orthopedics, spine surgeon,
Hmm. Hmm.
joint replacement,
Right.
and trauma surgeons.
Correct.
So we are blessed with a wonderful team at our
Yes. Correct.
hospital,
And
which
of
is
course,
available 24
Bhaktivedanta
hours.
Hospital has all the services under one roof, and of course, with the top-notch consultants we have in our orthopedics department as well.
And
S-
just sorry to disturb you,
yes, sir.
but as well as one of the best operation theaters
Yes, absolutely,
and trained
absolutely.
staff and
Yes,
ICU.
correct, correct, true, sir. So now we are ending up with the as the time is tickling. So thank you so much, sir, for your invaluable time and throwing us and showing us the insights like how to take care of our bones and joints in our daily care basis. So in that case, we end up the session here, and with uh, the saying Hare Krishna, we can end up this
Hare
session.
Krishna. Thank
Hare
you very
Krishna.
much.
Take care of your
Have a good
health.